Millions of children who are struggling with obesity. The American Academy of Pediatrics now saying that we can no longer just wait and see, and that it's time for action. One of the major headlines to come out on this today, the Academy now saying that weight loss surgery is something that should be considered now for children. ABC Action News reporter J.J. Burton going deeper tonight.
Obesity in America isn't going away. In fact, doctors say it's getting worse, especially for young Americans. The CDC says 20% of American kids and teenagers are obese. And that's the reason the American Academy of Pediatrics is saying something must be done now.
We can no longer take sort of a watch and wait approach for children who have weight issues. And so
Dr. Raquel Hernandez is the medical director at Johns Hopkins All Children's Hospital Healthy Weight Initiative. And she's on board with the new weight loss treatment recommendations from the AAP, saying pediatricians and families have to start having these real conversations about weight with their kids who are overweight or obese.
Don't just tell your patients eat less and exercise more. We're way past that. We're way past that. And really, I think recognizing obesity as a disease versus a personal decision is probably the biggest message.
The two big takeaways from the AAP's recommendations: anti-obesity drugs for children who are 12 and older, or weight loss surgery for kids who are 13 and older. That doesn't sound like a good idea for some, like Eric Bill.
It's maybe not only maybe a little premature, but maybe a little, drastic to kind of maybe take that approach.
He's the manager and head trainer at True Grit Fit in Tampa. They work with kids ages 12 and older.
I think that, starting early with kids and creating healthy habits such as healthy eating, being active, and healthy rest too. I think all three of those things are really huge to help kind of children, prevent any type of, disease down the road.
And doctors agree, saying starting early to prevent obesity is ideal, but for some, that's not possible, especially for kids who are already obese. Dr. Hernandez adds it's important to understand they're not saying kids who are overweight should start taking pills and getting weight loss surgery. And she says there are levels and criteria.
So that's actually something that's very clearly outlined in these new guidelines, which is very helpful. So those choices very much match severity. So for patients who do not have health-related issues from their weight, or who are low severity in terms of their weight, medications and surgery probably wouldn't be the immediate recommendation.
And the AAP also did a study on weight loss surgery, and in that same report, they say the surgery is safe for kids who meet that criteria. And J.J. Burton, ABC Action News.